February is both Black History Month and it's also Heart Month.
Yeah, and unfortunately, though, Black Americans are 40% more likely to suffer from heart disease compared to white Americans. Good news is that many things that people can do to reduce their risk, all people can do for developing heart disease. This morning, we have Allina cardiologist Dr. Mosi Bennett here joining us live this morning. Dr. Bennett, thanks for being with us today.
Hi, good morning. Thank you for having me.
Why don't we just start with the basic, because when we say heart disease, we could be talking about a wide range of things.
Yes, heart disease is a general term, and it can refer to a number of conditions. We're familiar with heart attacks, which is a problem with the blood supply to the heart. There's also heart failure, which is a problem with the heart pumping function. There can also be problems with the conduction system, the electrical system of the heart, which can lead to problems with the heart rate or heart rhythm. All of that is heart disease. And it's also important to remember the risk factors for heart disease: high blood pressure and high cholesterol.
And why is it that we see Black Americans who have more problems, more severe heart issues, 30% more likely to die than whites?
Now, that's a great question, and there are many factors. There are social determinants of health that affect the likelihood that someone would get heart disease or get the right treatment for heart disease. Unfortunately, we see racial disparities in access to care, access to insurance, the ability to live in a safe and healthy neighborhood, the ability to have access to the right food or exercise. And we also see disparities, racial disparities in access to the necessary doctors and specialists. All of this leads to disparities in heart care.
So, Dr. Bennett, what do you see? I mean, you see this every day as a cardiologist. What do you see as a way to combat that, to fight that?
Well, there's many ways we can tackle it, but I would say the first level is awareness and education. On the individual level, being aware of your risk factors for heart disease and having them addressed. For example, knowing your numbers, knowing your blood pressure, knowing your cholesterol, making sure that you follow a healthy diet, making sure that you get the right amount of exercise, and if there are problems, bring them to the attention of your doctor.
Yeah, I tell you, I've been interested in how when I go to the dentist, they now take my blood pressure, which I think is great. Like, it's just another way to check that and give you a heads up and say, like, hey, you might want to get this checked out.
Absolutely right. The blood pressure is an easy way to screen for the potential heart problems. And unfortunately, we have many people who don't know that they have high blood pressure, and even if they do know, it's not well treated. So we're seeing the ability to check blood pressure at the pharmacy or at home. It goes a long way to identify heart problems.
Dr. Bennett, are you busy right now with COVID, with seeing people with heart problems?
Yes, we've been very busy with COVID-19 and people being hospitalized and critically ill. But what we're seeing is not only an overlap between COVID-19 and heart problems, for example, inflammation of the heart and worsening heart failure. We're also seeing people who delayed their usual heart care because of the concern about getting COVID or because resources are being diverted towards COVID. So when people do show up with heart problems, a lot of times they can be a lot sicker and require a lot more help.
All right.
Dr. Mosi Bennett from Allina Health, cardiologist. Thanks for being with us, doctor. We appreciate it.
Thank you so much for having me.